Hey everyone, so it is now 5:05 and we will be letting more participants in throughout the seminar, but for now we're just going to get started with our introduction. So if you don't know, we are Advocate for Lives, a youth-led organization that raises awareness for blood and organ donation as well as health-related research. And before we start Dr. Amina's presentation, we just want to go over some few housekeeping rules. We'd appreciate if you don't spam the chat or use any swearing or inappropriate language, as well as keeping everything in the chat relevant to the seminar. As well, please make sure to mute yourself unless otherwise asked by our supervisor. And this session will also be recorded. You guys probably already got that notification. We do that so that we can post it on our YouTube channel so you guys can watch these seminars whenever you'd like. And finally, we'd appreciate it if, for those of you who'd like volunteer hours for this session, to change your name to the one you'd like on the certificate. We'll explain more about the process later, but this will just help us make sure to see who did attend the seminar and all of that. So now that we've got all those rules out of the way, we're just going to be talking to Dr. Amina Ahmad today, who is currently a diagnostic radiology resident in Long Island, New York, and is also at the Medical College of Georgia as an aspiring interventional radiologist. We'll be adjusting all the questions through the Google form as well as the chat at the end of the presentation. So without further ado, Dr. Amina, please take it away.
Thank you so much, you guys. It's such a pleasure to be here this afternoon, evening, wherever you guys are calling in from and tuning in from. It's such a pleasure. And today I'm really excited to be giving you guys a talk. We're going to be talking about a couple of different things. And we're going to be talking a little bit about transplants, a little bit about my journey into radiology, and then we're going to go over some cases towards the end, which will be a little bit more interactive. So I'm really excited about this, and let's jump right in. Here, if you guys want to take note, I'll have this on again at the end. But if you want to reach out to me on social media, I have an Instagram and then a Twitter account as well. And feel free to message me on there after this presentation if you guys have any questions. I'm always available. So I just wanted to start out with telling you guys a little bit about myself. So I'm from Atlanta, Georgia. I grew up there, and I did my undergrad at the University of Georgia. I majored in biology and ecology, and from there I went on to do med school at the Medical College of Georgia, and I did my internship for 1 year in medicine at Grady at Morehouse in Atlanta. And right now I am almost finished. I've still got a year and a half of residency at Stony Brook and Mather Hospital in Long Island. So as you can see from here, it's been quite a long journey, definitely over a decade since I started as a pre-med. It really kind of makes me feel old sometimes, especially talking to you guys, but you know, it's all about the energy. The age is just a number, and you know, as you can see, this process requires so much dedication, and immediate gratification is not, if that's what you're looking for, this career might not be right for you. But with that said, oh, this slide is a little blurry, I'm sorry. So I put this slide in there. I don't know what medical specialty to choose. So a lot of people come into medical school and they really have no idea what they're going to do. And this was just a funny graph that people came up with. You know, here they ask, like, how are your grades? Do you like to cut? Meaning, do you like to do surgery? What do you enjoy in your free time? Do you like people? What do you think about kids? It's funny, and sometimes it's realistic and sometimes it's not, right? Because you may start thinking, oh, I want to do pediatrics or I want to do surgery, and you might end up in something completely different. And along those same lines, this was a study that was actually published. And it showed what medical students' perceptions were of different specialties. So you can see here, people think psychiatrists are talkative, crazy, analytical, weird. They think radiologists are dark, lonely, boring, reclusive. And what I will say to you guys is that you'll hear this kind of stuff all throughout your training. And these are just what they're written right here. They're generalizations. So they may or may not apply to someone that you meet that's in the field. I can definitely tell you, I am not a boring person. I do not like spending time in the dark. I love meeting people. I love talking to people. I'm very social. So for me, like a lot of these things written here don't fit. Yeah, I don't fit that description. So this is just for you guys to sort of, both the previous slide and this slide are just for you guys to get an idea of the things you'll hear along your path, but they're just generalizations. They're just things people throw out there, but it's not necessarily, it doesn't have to be true for you. Okay. So I wanted to tell you guys a little bit about my story. This is my family here. This is my husband. This was on our wedding day. This is my mom, my brother, my dad, and my 3 sisters. And between the 7 of us, my immediate family, we have experienced 3 organ transplants. And my mom was the first organ transplant recipient. My mom was diagnosed with breast cancer when I was in high school, and she actually underwent a bone marrow transplant, which at the time was a newer treatment for breast cancer. And my mom had a pretty aggressive form. So she was the first survivor of a transplant in our family. The second survivor is my older sister, and she's pictured here in green. My older sister has a very special story. She's the reason that I'm here. My parents moved here from Pakistan because my sister was born with a congenital heart defect, and she actually, they couldn't treat her. They said she needed surgery. And so my parents came here, they came to Stanford, and my sister had surgery done by the father of heart transplant surgery, Dr. Norman Shumway. And she was operated directly by him. And my sister was also more recently, it was 3 years ago, a recipient of a liver transplant. So she is a dual transplant survivor. And like I said before, between the 7 of us, we've experienced 3 transplants collectively as a family. And I say collectively because transplants are a huge experience, and it's never just the patient. It requires your family, it requires a support system, an entire transplant team, all the way from pre-transplant through transplant to post-transplant. Even to this day, we still rely on the transplant team that takes care of my sister and coordinates her care. And it's really a wonderful and miraculous process that, looking back, 50 or 75 or 100 years ago, we didn't have. And I share this story because, in my immediate family, we saw 2 lives that were saved, but countless lives were changed. My life, my parents' life, my siblings' life, my sister, who's pictured here in green, is married, her husband's life. So there's just so much that people do in the world of transplant surgery that is new, exciting, and definitely changes lives. And I'm so happy that you guys are out here advocating for that. So I, as a radiologist, or radiologist in training, since I'm still in residency, I wanted to talk to you guys a little bit about what's the role of radiology in transplant? And I want to start out by telling you guys that, 75 to 100 years ago, there was no way for us to look inside the human body without doing surgery or opening up the patient after they were dead through an autopsy. And that is, if you think about it, pretty miraculous. My sister, who I talked about earlier, we did not know that she had cirrhosis from an autoimmune problem until she had a liver ultrasound. And 50 to 75 years ago, she may not have survived because we didn't have the non-invasive imaging to detect that early. So I've given a few examples here. Here I've shown an example of a renal ultrasound using Doppler. Here's a renal ultrasound of the transplant kidney. Here's an MRI of the transplant kidney. So we use ultrasound, we use MRI, we use CT to detect possible causes or needs for a transplant. We use it to detect whether a patient is a transplant candidate. We use it to look for post-transplant complications. Here's an example of a preoperative chest x-ray in a patient to see if they were a candidate for a lung transplant. And if you look here in the corner, I've talked about liver transplant and the different types of liver transplants. So you can have orthotopic liver transplants where you take an entire liver from someone else who's been declared brain dead and put it in someone else. Or you can do a split liver transplant where only a part of the donor is put into a transplant candidate. Or you can do an auxiliary transplantation. And this is temporary transplantation of a liver portion while the remaining part of the native liver stays intact. So these are just a few examples of the critical role that radiologists play in identifying pathology before, after, and after transplants. And this is really critical. My sister gets MRIs every now and then just to keep track of her transplant liver, see how it's doing. So again, I want to emphasize that it's a team. Transplant is a team. It's about being part of a huge team, and radiologists again play a big role in that team at all stages of a transplant individual's life. So now I want to switch gears a little bit and talk to you guys and delve a little bit more into what I do, right? So part of what we train in is transplants and radiology, but we also do a bunch of other things. And a lot of people at your stage, sometimes even people who aren't in medicine and are have been to the hospital don't really know what we do. So I wanted to talk about the subspecialties in radiology. We have so many different things you can do. If you're interested in working with your hands and doing procedures, we have breast radiology, interventional radiology, musculoskeletal radiology, nuclear medicine. If you're interested in working with children, there's pediatric radiology. If you're interested in learning more about different brain pathologies, there's neuroradiology, body imaging, chest. If you want to be surprised and do a little bit of everything, there's emergency radiology. So we just do so many different things and not a lot of people know about it. And so I wanted to share that with you guys. So as you move forward in your career, you consider radiology and you realize that it's not just one thing. It can be whatever you want it to be. And so now I want to talk to you guys about modalities, right? So let's talk a little bit more about what we do on a day-to-day basis. When you talk to a radiologist, they'll talk to you about, oh, we should use this modality to detect this disease, that modality for that disease. So what do they mean? What are they talking about? They're talking about how you acquire the image. What do you use? Do you use ultrasound? Do you use sound waves for ultrasound? Do you use x-rays for interventional or fluoroscopies or CTs? Do you use magnetic resonance imaging for MRIs? They're basically talking to you about how you get that image. What are you using? What is the patient type of radiation they're receiving? And how does that help you get to the best diagnosis? So that's what we mean by modality, okay? And when we approach an image, the first thing that we want to do is say, what modality are we looking at? Am I looking at an ultrasound? Am I looking at a CT? Am I looking at an MRI? What are we looking at? And then the next thing we want to do is ask ourselves, how did we get this image? In a hospital, you can either have patients come down to radiology department and get their images taken, or if the patient's very sick and they're in the ICU or the emergency department, we can take our x-rays portably and go to them. So all of this plays a role in how we evaluate the image. The next few things are learning about why the patient is here. What's their history? What is their primary concern or chief complaint? And then the next thing that we want to do is use a search pattern. So if you give me a chest x-ray, how am I going to look at it in a consistent, organized manner so that I'm getting the best out of the most important information out of the imaging that they've ordered for this patient? And then pertinent positives and negatives. This is a phrase that you'll hear thrown around when you're in med school. And essentially what it means is saying yes or no to certain findings that are going to help direct you in a certain direction when it comes to making a diagnosis for your patient. So imaging planes are really important. And if you guys have taken an anatomy class, you're probably familiar with this. If not, it's very simple. It's basically, how are you slicing the patient when you're looking at them, or when you're doing an image, or when you're looking at a certain part of the anatomy. So if you're going from side to side, right to left, or left to right, that's the sagittal plane. If you're going from front to back, that's the coronal plane. And if you're going from head to toe, that's the axial plane. And that's just a simple way to think about it, but it's important because it's going to help you orient yourself when you're looking at an image. And the last thing here is descriptors, okay? As radiologists, we have to communicate our findings in terms of what is the anatomy we're looking at, what is the severity of the findings that we're making, and then what are the findings? So here I've just given some examples. The heart is grossly enlarged, okay? Heart, that's the anatomy. Grossly, you could also say severely. It tells you the severity. Enlarged, that's the finding. No active lung lesion. So you're talking about the lung, the anatomy. Lesion, you're talking about the finding. Active, you're talking about severity. There's nothing active at this time. So this is sort of a very simplistic way of how we approach communicating our findings when we're looking at imaging. All right. So now I want to jump into radiology cases. This is the more interactive part of the presentation that I have for you guys. And I really like doing this because I think it gives you guys an idea, a better idea of what we do on a day-to-day basis, rather than me just telling you. So instead, I'm going to show you. And we'll start with this, okay? So here I have a chest x-ray, and I want to use exactly what we talked about earlier. So the modality here is a chest x-ray. The imaging plane is a frontal or a coronal, and we use our search pattern, okay? So for me, when I look at a chest x-ray, I start by looking at the lungs, and I just make sure they look symmetric on both sides, from the top of the lung to the middle to the bottom of the lungs. Then I evaluate the heart. I look at the heart borders, and then I look at the diaphragm, and then I look at the airway, the trachea, and then I look at the bones. You have your clavicles, you have your ribs going across on both sides, and then you have your scapula as well. And then finally, I end by looking at the soft tissues just to make sure there's no crazy finding over there. And this looks completely normal, okay? And this is another case, okay? We have the same modality. This is a chest x-ray. This is a coronal plane. And we have a large consolidation in the right middle lobe. This patient had a history of fever and chills. So the diagnosis is a pneumonia, okay? So you put together everything in a very organized fashion to get at the answer that you want to get at. All right. So now let's move up in terms of different modalities. Here we have a CT, and we're looking at a coronal plane, okay? And I'm just going to show you some of the normal anatomy. So here you have the base of the heart, you have the diaphragm, you have the liver, portal vein, gallbladder, stomach, part of the spleen, small intestine, colon, urinary bladder, and we've got bones here of the pelvis and then the hips bilaterally. And then we've got some of the muscles as well and subcutaneous fat. You can see the ribs down here as well. So this is a pretty normal CT, okay? Now we're gonna move to a different case. So this is, again, our modality is a CT coronal imaging plane. And here in the liver, we see a large, well-circumscribed, heterogeneous mass with enhancing internal septations. And the history was this patient was asymptomatic. So in this particular case, this was a liver hemangioma, okay? And those are incidental findings. They're not cancer, it's not malignant. You see them oftentimes in young people. Sometimes they can get so big that, or they can bleed. And so, you know, it's just but it's knowing what these look like and the characteristic findings will help you make that diagnosis. So the next case I'm going to show you guys is an ultrasound. So modality ultrasound, this is a sagittal view of the uterus. You see the outline of the uterus here. This is the bladder in front of it. And then the uterus leads into the vaginal canal. So this is a different case. Again, you see a sagittal uterus on an ultrasound, and you see a yolk sac. And in this patient, the history was a missed period. So this is the diagnosis is an intra-uterine pregnancy, okay? And the last case I want to show you is of a mammogram. So remember, we talked about breast radiology as one of the subspecialties in radiology. And one of the modalities that we use is a mammogram. So here we have the pectoralis muscle. We have the skin of the breast. You have the nipple. And then you just have fibroglandular tissue and fat within the breast. And this is normal. And this is opposed to this image, which is also a mammogram. And you see a spiculated mass here. And this is in a patient with a family history of breast cancer. So the diagnosis ended up being breast cancer. So that's it for the cases. You know, I want to leave some parting words. So the next few slides are just some things that I like to always tell people at your level. Radiologists are physician detectives. So as you've seen with some of the examples that I've just shown, we use imaging to help the clinicians solve diagnostic mysteries. We play an absolutely fundamental role in preoperative evaluation of transplant candidates and a critical role in evaluating post-transplant complications. Radiology is one of the most difficult specialties, and I say that not just because I'm doing it right now, but because there's really so much to learn and know about every organ system, every specialty. And as medicine and transplant surgery continues to evolve, we're going to have to evolve. We're going to have to keep learning, keep training our eyes to find, to make these new findings so we can help improve our diagnostic capabilities. So, you know, this is just something that I have. If you follow me on social media, if you choose this career path, it's going to be amazing. Like I said, 100 years ago, we couldn't see inside the human body without opening it up during surgery or after the patient was dead. So there's so much that we can do with all of the technology that continues to advance. And I feel like we're so lucky to be in this field, and I really hope you guys will consider it. My advice for you guys, people always ask what, give us some advice about pursuing a career path in medicine. At this stage, I think it's really important to expand your network, meet as many people as possible, do all of these shadowing sessions, continue to put yourself out there, ask questions. How can you make yourself a better candidate? How can you learn more? How can you contribute? There is a need for each and every one of you that's here today. Medicine needs you, society needs you, the world needs you. You just have to find out where you're going to fit in to this giant puzzle piece of a universe. And I'm happy to connect you guys. I will leave my social media links in the chat as well. And lastly, I want to leave you with this inspiration. As a woman myself in medicine, a lot of times you will be faced with people who don't believe in you, right? Or they might look at you and say, I don't think she's going to be able to make it. I don't think she has what it takes. Don't worry about those people. If you believe in yourself, if you want something, go for it. Don't let anyone stop you. Don't let what they say stop you. Don't let what they think stop you. You have to, at the end of the day, continue to believe in yourself at every step of the way, and then you're going to make it. And I can guarantee you that because I'm an example. So don't give up. Keep believing in yourself. And thank you guys so much for your attention. Again, like I said, it's a pleasure to be here. Thank you guys for coordinating this and for having me. And with that, I'll happily take any questions that you guys might have.
Yeah, so thank you so much for your presentation, Dr. Amina. We really enjoyed it. And now we're just going to be moving on to the questions that the participants have given through their Google Forms when they signed up. And participants, if you guys have any more questions, just put it in the chat and then we'll get to those right after.
Yeah, for sure. So our first question, and you did talk about this a little, but what made you choose radiology and why are you pursuing interventional radiology?
That's a great question. So for me, when I was in med school, I actually had considered doing ophthalmology initially. I really liked it. It had a lot of cool technology or working with your hands. But one of the things that I kind of found limiting was that I had just spent 4 years learning about every organ system, right? Like from head to toe. And now I would just be focusing on the eye. And I just felt like I didn't want to lose all of that knowledge that I had just learned, in 20 years of practice. And so one of my friends actually, a senior medical student, had switched into radiology, and she told me that she loved it and she highly recommended it. So I did a rotation. I ended up liking it, and I matched into diagnostic radiology. And I really loved my experience in diagnostics as well. I think it's been a really fun residency, and you just get to see and do a lot. But when I got to my interventional rotation, I realized that I missed patient contact, and I just really liked being around patients and also working with my hands and being able to use imaging to make a difference, right? Like from start to finish, like you do a nephrostomy or a port placement, like you can see the difference that you've made in a patient's life, and they're very grateful. And for me, it was just more about like realizing what I was missing and just incorporating that into my choice for a future career. So that's how I came to that decision.
Yeah, I think definitely people will keep that in mind when they're choosing a specialty. And the next question is, how do you balance your work life with your personal life? How did you do that as a pre-med, and how do you do that now?
Yeah, that's a great question as well. And I think, you know, two things. One is you need to know what you need, right? What makes you feel good? And for everyone, that's going to be different, right? There's so many different components of what makes a person feel good. It could be spiritual, it could be physical, right? It could be like just you you have to know what feeds your mind and what feeds your body and what feeds your spirit. So for me, I'm spiritual, I pray, and I think that that's helped me a lot in life. And I try to keep that up through as a pre-med. I even remember, thinking I'm like, I don't think I'm the smartest person in the world. And I would just pray to God. I'm like, if you think that I'm capable of doing this, just please help me get where I need to be. I literally used to make that prayer because I was like, I really don't think of myself as the smartest person. And that was my prayer. It was like, just if you think this is the right path for me, help me get there. And to this day, when I struggle, when I feel like I'm not smart enough or I'm not good enough, I still make that same prayer. And so that's one thing. And for me, I used to be really terrible about not eating well, not drinking enough water. Like I would just kind of be very sporadic. I would eat junk food, and it was terrible. I was really, really bad about that. But when I became aware that all of those things were having an impact on like my energy level when I was a med student, when I was, in residency, I started to make changes. Little things like, making sure you hydrate when you wake up in the morning, trying to eat healthier. Like, guys, junk food, I know it's really like enticing, but it's just not good for you. It's not going to make you smarter. If anything, it might make you dumber. So try your best to get your veggies in, try your best to, do stuff that's good for your body and your soul. And then, like I wasn't really like, I'm not very athletic. You can probably tell just looking at me. I'm not like a marathon runner, but I do yoga. It's something easy. I bought a yoga mat for $15 off of Amazon. I just wake up and do it for 10 minutes a day. I think it's important to just find your 5 or 10 minutes, if you can, if not more, to just do the things that bring you happiness. I'm married, and in residency, I've spent a lot of time with my husband um, and with my family and friends. And I think that brings you balance. Because remember, you're only going to be good to your patients deserve the best of you, right? Like the healthcare system deserves the best of you. And if you're not taking care of yourself outside of the hospital, outside of all the things you need to know, learn, contribute, you're doing them a disservice. So fill your own cup first, be good to yourself, do like nourish your mind, body, soul, and then you're going to be able to do the best for your patients and get the most out of your education. So yeah, I definitely encourage you guys to start paying attention to that today.
For sure. I think that's a great point. I think what you said was really relatable for a lot of us. But going off of that, one of the questions we had was, as a radiologist, do you still have time to travel and do a lot of your more personal, fun activities with friends and family?
Yeah, I think radiology is one of the best fields for what they call work-life balance. I'll tell you guys, pre-COVID, when I was an intern, which is a really grueling year, my husband and I went to Europe for a week, and we went to like 4 different countries in like 6 days. We did like the Czech Republic, we did Germany, we did Vienna, we did Scotland. So I've traveled a lot actually in the past couple of years. And I think it's just planning, right? Like you have your vacation weeks, you just save your money, you plan where you want to go. And I definitely have time for my hobbies, not for all of them, but for the 1 or 2 that I actually enjoy, I definitely keep up with them. And you know, it's all about prioritizing. So one thing that people say is, I don't have time for this, right? And when I hear that, I always say, no, it's not that you don't have time for it, it's that you don't prioritize it, right? So instead of saying, I don't have time to work out, or I don't have time to eat healthy, or I don't have time for my hobbies, instead say, I don't prioritize it. And then see how that changes your life, because it will change your life. Because when I started saying that to myself, I was like, oh, well, I'm going to prioritize it, and I'll wake up an extra hour early so that I can do my yoga, so I can eat breakfast, so I can, you know, get dressed and be at work at the same time, because all of those things are important to me. I want to be good at what I do. I want to be healthy, and I want to have a sound mind and body. So once you start prioritizing all of those things, then you're going to be able to do them much more so than if you just say, I don't have time for that. So with regards to that question, I would say you do have time for it if you prioritize. And I think learning to do that early is very beneficial.
Yeah, I think we all need to work on that time management and prioritization side of skills. So now for our last question, someone was wondering, is there a lot of physics and math involved in radiology?
So there is not math as much. I would say the math is pretty simple. There is physics, but not it's not crazy physics. You really have to know physics to pass the exam, because we have to take the boards, which I'm taking in a few months. So I'll tell you guys, this morning I was studying physics for a few hours, and it's funny that you mentioned physics, because I have a book right here, right in front of me, that I was studying from. So you do have physics, but I want to say this. A lot of people think that the physics that you have to learn for this test or in radiology is the physics that you take in college, which is completely different. I did not do well in physics in college. I wasn't like the A+ student in physics. You know, I went through the class, I did okay, and it's done, right? I filled the prerequisite. For medical physics, which is what you do need to know, it's much more, you can understand it, and you just have to know like a bare minimum. And I want to encourage you, especially all the women in the audience, do not feel discouraged, because a lot of women feel discouraged. They're like, oh, I don't want to do physics, I won't go into radiology. No. It's a very small amount of what you have to do, and you can learn it. I promise you, if I'm smart enough to learn it, you're smart enough to learn it too. You can and you will. So don't let that dissuade you. It's not, it's tough, but it's doable.
Okay, thank you so much for your answer, and thank you so much for your presentation. That's all for our questions. So if anybody has anything else they want to ask Dr. Amina, please put it in the chat and we'll make sure that you answer it. So just quickly for the participants, make sure to fill out the volunteer form in our link tree, which will be posted tonight. And that's to receive your volunteer hours. Once you finish the quiz, if you do get 50%, we will send you a certificate on Tuesday, and this will contain your volunteer hours.
Wonderful, guys. Well, thank you so much for having me again. It was a pleasure. And keep up the great work, everyone, especially the people who organized and everyone who showed up today. You guys did really well, and I wish you the best of luck. And like I said, feel free to reach out to me on social media. I have a doors open policy. So yeah.
For sure. We just got a quick question in the chat right now.
Oh,
Yeah, the question is, for those of us in high school, do you recommend anything we can get started on now that will help guide us for medicine in general, I think?
so for those of us in high school,
Yes.
is that correct? Okay. Yeah. Not particularly in high school. I would say in high school, if you can take some advanced classes in like chemistry and physics, it might be helpful to you in your in doing well in your prereqs in college. But other than that, not coursework wise, I will say, just try to do well in those courses if you can. And then, develop yourself a little bit outside of school. As you go on, med school, a college med school, it becomes harder and harder to keep up with your hobbies. You can, but it's a little easier to develop your hobbies in high school. So if you have something that's like, that you're working on or that you're passionate about outside of school, I would definitely flesh that out a little bit and try to develop it so that, when you get to the point where you're applying to med school, it's like, I've been doing this cool thing for like 6 years now, right? Instead of just like, oh, I picked up this hobby like 3 months before I applied to med school just to show that I have a hobby and I'm not like, just a boring person that studies all the time. So I would say that, yeah, those two things, your prereqs just to help you when you get to college. And then trying to work on one or two hobbies that you think that you actually like. You don't have to make them up just because you think they'll be impressive, but something that you actually want to do.
Yeah, I think that's a great point. You really need to be passionate about these things. You're spending extra time on them. But we do have another questions about this. They're asking, what clubs or activities were you a part of during high school?
During high school, oh man, that's a long time ago. I was pretty much like a big nerd in high school, I have to be honest. I did not do much. I really developed my extracurriculars in college. In high school, I just did I did science Olympiad, I did math team. I did a lot of things that were pretty, just, I wouldn't say I had a ton of things that I was involved in outside of the academic sphere. I wish I had. Looking back though, I really wish that I did more stuff that wasn't purely academic. I forget, there was an HSA, health OSHA or something like that. I forget, organization of health sciences, something. I did that. But yeah, I have to be honest, me personally, I did not do a ton of extracurriculars in high school. But like I said, for you guys, me looking back in the mirror, wishing I could give advice to my younger self 10 years ago, I would have definitely tried to step out and get more just more well-rounded. Yeah.
For sure. Just to confirm, did you mention that you did HOSA when you
Yes, I forgot. It's been so long. See, you guys are aging me. It's been so long, I forgot what the acronym was. Yeah, that's exactly right.
Awesome. Thank you.
Sure.
Okay, so that seems to be all of the questions that we have for you today. So everybody, thank you for attending, and Dr. Amina, thank you for presenting. And make sure to keep a lookout on our Instagram to attend more of these amazing seminars with amazing speakers. And make sure to follow us to get more volunteer hours, guys, and learn more about healthcare professionals. So thank you guys for attending.
All right, take care, everyone. Have a good day. Bye.
For sure.
Thank you, bye.
Everyone.